Welcome to this webinar on work-related fatigue. Over the next 80 minutes, I'm going to discuss with you not only ways how we as managers and supervisors can go about managing this particular workplace hazard, but also some background concepts, which can help us all understand why these measures are so necessary. For those who don't know Wood, we're a global leader in the delivery of project management, engineering, consulting and technical services to energy and built environment customers, and operate in more than 60 countries. Wood delivers a comprehensive range of services to support our customers across the entire asset lifecycle. We are a business where fatigue is a risk globally as a result of our 24/7 operations, and is certainly something that we have been impacted by in the past as a result of several driving-related fatalities, and which we are in the process of addressing through our own global fatigue management standard and country-specific procedures. But before I start speaking about managing fatigue, I'm going to give a quick reminder on our legal requirements around fatigue. In Australia, we all have duties under the state's work health and safety legislation in relation to identifying and managing workplace hazards. Businesses in particular have quite specific duties, and many of us viewing this webinar today will be involved in supporting them to meet not only their duty of care, so that as far as reasonably practicable, workers or other persons are not exposed to health and safety risks at the workplace, but also support the provision of safe systems of work, monitor the health of the workers, as well as the conditions under which they work. Of importance, which I will discuss more on later, is that businesses also have a duty to consult with our workers. This collaboration has important benefits for everyone and has been particularly helpful when managing fatigue at Wood. It has helped not only in identifying our particular workplace risks in various operations around the globe, but also helped make sure that the control measures we did come up with were not only practical, but also likely to be followed as well. And there is more. The model legislation also requires those with specific leadership roles in businesses, such as directors and workers with influence over business decisions, to undertake due diligence. Workers such as yourselves also have specific duties in relation to work health and safety in workplaces. Due diligence involves directors and those with influence over business decisions taking steps to ensure that the business complies with the duties that I mentioned before. This means taking reasonable steps to ensure that your business has and uses appropriate resources and processes to manage your particular risks, and this includes those for fatigue. A big part of due diligence is also making sure that you keep up to date with your knowledge and understanding of the health and safety matters that apply to your specific operation and industry. And this webinar aims to provide some of this when it comes to discussing the management of fatigue. Fatigue is a very important workplace issue that we are all required to manage, both at the business as well as personal level. It has wide-ranging consequences not only on our mental and physical health, but can also impact on the health and safety of those who work around us. However, before I go into more detail on fatigue, I'm going to start with a reminder of some basic concepts on workplace hazards and risks. All our workplaces have hazards. A hazard is anything that has the potential to cause harm and can range from physical and chemical hazards to biological, psychosocial, such as fatigue, as well as ergonomic hazards. Risk, on the other hand, is the possibility that harm including death, injury or illness might occur as a result of exposure to that hazard. Identifying the hazards present, assessing the risks that these create, as well as ideally eliminating them or at least minimising them as much as possible by following the hierarchy of controls, are crucial activities in every Australian workplace and is part of our duty of care, especially when we think about the psychosocial hazard that is fatigue. For those who may not have heard the expression before, the hierarchy of control is a system of actions used to minimise or eliminate the exposure to hazards. They follow a hierarchy in order of decreasing effectiveness, from elimination and substitution to isolation and engineering, administrative and personal protective equipment, which is the least effective of the controls. But these crucial activities don't just end by applying the control measures, they must be maintained on an ongoing basis to make sure that they continue to reduce the risk from workplace hazards and are working effectively, as well as remaining fit for purpose. These measures put in place should be regularly reviewed to ensure that they not only continue to provide the necessary controls, but identify if any changes are necessary due to new hazard identification, a result of workforce consultations, and also prior to any process or operational changes that could pose a risk. When it comes to the risk of fatigue, we need to be clear what is meant. One thing I've come to appreciate is that many people think that fatigue is the same as sleepiness. However, they are actually different, though related states. Sleepiness is the tendency to fall asleep, while fatigue is the body's response to sleep loss, disruption of the body's internal clock, or prolonged physical or mental exertion. When we speak about fatigue, it's difficult to find a single definition to articulate what fatigue really is. However, all the definitions that exist in various Australian guidance agree that fatigue is not simply tiredness. It is something that has a direct effect on our attentiveness, alertness, and judgment, and that's why it's so important that it gets managed. Fatigue is a complex issue, but because of our tendency to just consider it as part of life, it perhaps prevents us from maybe thinking about it as the serious risk it is. The aim of this webinar is to influence this mindset and appreciate that it is something that we need to manage better. We can all get fatigued, especially in this increasingly 24/7 society that we live in. The reasons for this can be basically broken down into because of how we work, because of personal or lifestyle factors, or because of a combination of both. I'm going to speak more about the work-related factors later, but in short, work-related fatigue causes can be broadly broken down into 4 main areas. The work task demands, which can be mental and physical, the work environment, the work time, and the work scheduling and planning, which provides the opportunity to get adequate sleep. The effects caused by these factors can all be compounded by personal or lifestyle factors. The personal or lifestyle factors are the underlying health conditions that our workers can have, such as sleep apnea and diabetes, or the influence that the inappropriate use of alcohol, prescription drugs, as well as illegal drugs can also cause. It also includes the emotional concerns or stresses that workers may have because of financial or domestic difficulties, as well as the result of undertaking strenuous activities outside of work, such as having more than one job, having a hectic social life, or religious and cultural commitments. Interestingly, research has also shown that a lack of physical exercise as well as a sedentary lifestyle can also lead to fatigue, as does poor diet and sleep disruption, which can come from family commitments such as new parenthood, something which I'm sure many people can relate to. Sleep deprivation, such as occurs with new parenthood, may be something that we think that we have to grin and bear and get through. But as I'll discuss later, you'll see these factors can have much more serious ramifications. An interesting study performed by Simba, the sleep technology company, showed that on average, new parents lost 50 nights of sleep in the first 12 months following the birth of their baby. That's nearly 2 months' worth of sleep being lost. So not surprisingly, fatigue can develop as a result of the impact of both these work and personal factors. And it's not just that workers aren't getting enough sleep at the time, it's that the sleep they may get is not what's called good quality sleep, or they're not getting enough time to recover since their last work period as well. These all impact on the ability to perform effectively and safely. And that's not the only thing that you have to consider. Fatigue can also be what is called acute, where it occurs over a short 24-hour period, or cumulative, where it builds up over days and weeks. It can be experienced because of a single episode of sleep loss, while ongoing sleep disruption or lack of adequate or restorative sleep, because of the work and personal reasons mentioned before, can lead to sleep debt. This in turn increases the risk of fatigue-related errors and incidents, impairs performance through reduced productivity, and increased absence. It explains why workplace fatigue is a problem that we all need to address. All our businesses and industries are affected to some degree by fatigue, but there are some types of work and some sectors that have inherently a higher risk. At Wood, because we undertake safety-critical tasks, which require a high degree of concentration, we have that higher level of risk. But other examples of activities which you should consider as high-risk activities include if your business operates plant or equipment, including driving vehicles, if you undertake work at heights, if you work with hazardous or flammable materials, or your business undertakes night or shift working when your workers would normally be sleeping. You also need to consider that some workers in your workplace may also be more at risk because of their job role, such as on-call or callback workers, emergency service workers, seasonal workers, as well as fly-in out, drive-in out, or bus in and out workers. I mentioned before about the legislation that requires us to manage fatigue, but there are also good business reasons to do this. Managing fatigue at Wood has seen less turnover of staff, and as a result, reduced costs in recruiting, less absenteeism from workers trying to self-manage their own fatigue, and improved productivity. It's to everyone's benefit to manage fatigue and do it effectively. As a quick aside, shift workers have been mentioned several times. Shift work has been described by the ILO, International Labour Organization, as a method of organisation of working time in which workers succeed one another so that the establishment can operate longer than the hours of individual workers. This type of working, as I'm sure you'll recognise, is increasingly used in our 24/7 society. The last available figures from the Australian Bureau of Statistics in 2009 revealed that 16% of workers were shift workers, which included rotating, irregular, evening, afternoon, morning, as well as split shift, and this will likely have increased considerably in number since then. Advice on shift and roster management will be discussed later on, how to manage the risks from fatigue, but a good resource to use if you undertake this type of work is the How to Manage Shift Work guidance issued by Safe Work New South Wales. I've already briefly mentioned that fatigue affects performance, so how does it do this? Fatigue can result in a range of adverse effects, not only on our attention, problem-solving, memory, motivation, but insight as well as emotional control. By looking more closely at each of these effects, it allows us to have a better understanding as to how dangerous fatigue can be, especially in the workplace, and how it affects workers' ability to make good decisions and perform their work effectively and safely. The effect of fatigue on our attention means that our attention span is decreased. We have lapses when we are doing safety-critical tasks, and we get tunnelling, which means that we narrow our field of attention. The impact on our problem-solving ability means that we are slower to interpret and integrate information, while our working and short-term memory are also both reduced. We also have a reduced ability to learn, and our decision-making becomes impaired. This means that we not only have difficulty weighing up options, but we also persist with ineffective responses. Our motivation and insight are also changed. We divert our attention to more interesting tasks. We are less likely to pick up someone's errors. We are less interested in outcome and experience end-goal seduction. Emotionally, we also feel low and irritable and are prone to terse communications. There is nothing positive to say about the effects of fatigue. One of the big risks, especially when driving, is microsleeps. That is a brief episode of sleep or loss of attention. But as you can understand, a microsleep when driving can mean you've driven some distance when your vehicle has in effect no one controlling it, which I'm sure you'll agree could well have serious consequences not only for the driver but for other road users. It's important to understand that fatigue in the workplace is not something that you can reverse with motivation, training, or experience either. It's about us as managers designing the work conditions and environment that encourages good sleep and recovery opportunities for our workers. As you can probably now understand, fatigue is a significant workplace hazard, and the effects are not just theoretical, but are sadly born out of everyday life. Fatigue has been cited as the root cause of many significant Australian accidents, including the Waterfall train accident in New South Wales in 2003, when the driver and 6 passengers were fatally injured, and the train guard and the remaining 41 passengers suffered injuries ranging from minor to severe. And it's not just rail accidents. In Australia in 2016-17, 3,017 deaths were linked to sleep deprivation, including 394 deaths from industrial accidents or road crashes due to lack of sleep, as reported by the Deloitte Access Economics report. Because of the significant risks faced by both the rail and heavy transport industries, specific legislation applies to them, including fatigue management, which I would urge you to review if you've not already done. Going back to road-related events, in New South Wales from 2008 to 2016, there were a total of 532 fatal crashes involving fatigue. This resulted in 583 fatalities, with fatigue accounting for 17% of all fatalities over this period. There was also a total of 6,321 serious injuries matched to a police crash report from fatigue-related crashes, representing 12% of all matched serious injuries. Over this period, fatigue was alongside alcohol as the second most common behavioural factor involved in fatalities behind speed. However, in recent years, fatigue has now actually displaced alcohol involvement in fatalities as the second leading behavioural factor. As reported by Transport for New South Wales in 2013 to 2017, more people died in fatigue-related crashes than drink-driving crashes, and this linkage is important. And these tragic figures are replicated in all other Australian states. Several years ago, Professor Anne Williamson from the University of New South Wales demonstrated that the impairment caused by fatigue is very similar to the effects that alcohol can cause on performance. She found that the behaviours demonstrated by those who were sleep-deprived against those that received alcohol were virtually the same response times, same reasoning, and same capacity. We wouldn't put someone behind the wheel who is blowing 0.1 alcohol concentration, but we expect people who may be sleep-deprived to perform in the workplace. A sobering thought. And it's not just the immediate risk of accidents and incidents that you need to consider, but longer term. Fatigue can lead to long-term health problems. The chronic effects of fatigue have been linked to increased risks of developing cancers, increased risk of heart disease, as well as high blood pressure. It's also been linked with reduced fertility, gastrointestinal problems, as well as diabetes, anxiety, and depression. The big message is that the impact of fatigue cannot be underestimated. As managers, we therefore face significant challenges when managing the risks from fatigue. What makes this more difficult is that though fatigue is known to produce effects when performing certain tasks, it is not easily measurable. There is no one unequivocal test to determine if someone is fatigued or not. Any testing done is largely based on subjective assessments. However, it is possible to manage fatigue and its causes, but from experience to do this effectively, you need to consider all the challenges. These challenges, I should add, can vary dependent on the size and complexity of your organisation. From experience, you need to be prepared to address the diverse operational requirements you may have, as even within specific work settings, individual job requirements can vary, so be mindful of this. You need to look particularly at the requirements of your job roles. Do they require continuous physical exertion? Are they repetitious or monotonous, or require prolonged periods of vigilance and readiness? All of these can contribute to your risks of fatigue. You need to ask yourself, are there ways this could be changed or managed better? Other challenges you need to consider are what your current practices are. Just because operations have been run in a particular way does not necessarily mean that it is the best way. Resistance to change and adapt to improve periods of sleep and minimise the risk of fatigue may well require a cultural mindset change, which is not necessarily quick or without resistance. Finance. That definitely has a part to play and can also be an obstacle. Not only do the economics of changing practices need to be addressed to help your businesses understand their risks from failing to manage fatigue, but you need to consider and budget the necessary costs to undertake the necessary hazard identification process and implementation of controls to manage this workplace risk. You need a good persuasion technique at times. Rapidly evolving technology can also certainly be of benefit to manage fatigue, but can also be met with a great deal of skepticism both from your workers, as they may perceive that Big Brother is watching, but also from financial controllers, who may well question the cost challenges such technology can bring. Operational cultures too need to be managed. Cultures of working long hours need to be addressed, and that needs to come from your senior management. They need to show by example that this type of working will generally not be acceptable. Cultural barriers can be one of the biggest challenges you have. You must get over the carry-on mentality. I'll push through and be fine. It's fine having business statements that say, no task is so important it can't be done safely, but your workers have to see that it is encouraged for them to come and say that they're concerned or that they're impaired by fatigue and something is done about it. It's also important that as a business, You don't just cave in and defer to the client when unreasonable demands are made, which could result in fatigue risks, but also you have a caring environment that workers can advise of issues going on in their home lives which could impact their safety at work, and you have a system to manage this. You can't sort their domestic problems, but you can make it safer for them at work and direct them to resources such as the Worker Assistance Program who can help. At Wood, our safety shield requires us to intervene should we see or believe that there is a risk of an unsafe act or omission. Having an interventional culture like this, where everyone is looking out for each other, can also help in managing your fatigue risks. And when I speak of cultures, as businesses, you also need to consider the community cultures that you work in, as you may also need to consider important cultural or religious events and the impacts of these when you manage your risks from fatigue. You know how your business operates and thinks. So once you have identified your challenges in managing fatigue, your next step is to identify all the reasonably foreseeable factors that could contribute to and increase your risk of fatigue in your workplace. So, what are these work-related factors that are contributing to fatigue? Well, work scheduling is probably the most well-recognised contributor, particularly if workers are subject to irregular and unpredictable hours, early starts, night shifts, long shifts, backward shift rotations, and they don't get adequate recovery time between shifts. You need to ask yourself, are you giving your workers the time to adequately recover, especially when considering the effects night shifts can have on the body's internal clock, which we will speak more about later. In short, when a body's clock is out of step from what it would normally be expecting to do, it can leave the worker feeling fatigued and place them at risk of increased errors, not only in work, but also getting to and from work. This is particularly important if you have operations where there are long or excessive commuting times. Is there a need to fly, bus, or drive in and out that you must consider? Other questions that you can ask yourself to identify the foreseeable risks that you have are around your workplace environmental conditions. Do you have noisy, excessively hot or cold work conditions? As these can all contribute to fatigue and make your workers tire more easily and affect their performance. Could organisational factors leading to a stressful work environment because of bullying, harassment, or other psychosocial factors such as bereavement, social or marriage status, loneliness, etc., also be resulting in fatigue in your workers? Is there any unplanned work, including emergencies, breakdowns, overtime performed? Are your workers able to get restorative sleep? All key questions that you need to consider. Restorative sleep is important. As I mentioned before, when workers don't get adequate sleep, they can build up cumulative sleep debt. Each day without enough sleep not only increases this debt, but also increases the chance of fatigue-related events and incidents, and may take several days to recover. And finally, have you considered the variable personal or lifestyle factors as mentioned before? There may not be obvious signs of fatigue in your workplace, but that does not mean that it is not occurring, nor that you don't have any of these factors, which may increase the risk that fatigue may occur. Everyone has the potential to be affected by sleep loss and fatigue, so is a hazard that we all need to appropriately identify and manage. So, how can you go about this? One of the best sources of information is thorough consultation with your workers. Ask them how the current work planning and scheduling works for them, and if it allows them the opportunities needed for restorative sleep. Consider if they have control over their hours of work, place of work, or rest breaks. Consultation is also a requirement under the work health and safety legislation as far as possible when you propose to change the working hours, schedules, as well as after a fatigue-related incident. But it also makes good business sense to get their input. After all, they are the ones most likely affected, but often are the ones most likely to come up with a practical, workable solution. Other sources of good information are your HR records. Look at the rate of your staff turnover. A high turnover usually indicates that something is wrong. Also, the amount of unplanned absenteeism, as well as a number of workers' compensation claims that you have. Fatigue should be one of the incident root causes recorded in your incident reporting system. Having this allows you to recognise if fatigue is a problem within your business And even delve into more details such as time of day that incidents are occurring so you can look retrospectively at timesheets of those involved, billing sheets, etc., to determine hours worked and identify if excessive hours have been worked or worked at times when body clock disruption could have occurred. For further help and assistance with this, I'd suggest using the fatigue checklist, which is part of the Safe Work Australia guide for managing the risk of fatigue at work. However, before continuing with ways of managing your fatigue risk, there are also some other background concepts which can be of assistance, starting off with sleep. Sleep is a highly complex process throughout which your brain actually remains active. It is essential for us all, yet many of us don't get enough, which may ultimately not only affect our own safety and well-being, but also compromise the safety of those around us. Our sleep-wake cycle is governed by the body's own internal body clock, found in the brain, which was mentioned before when I described how fatigue was a consequence of disruption of this clock. It is made up of a group of cells called the suprachiasmatic nucleus, or SCN. This is found in the hypothalamus, an area of the brain just above the optic nerves, and is directly influenced by light. Given this proximity, the level of light entering the eye provides the main cue in turning on and off the genes that trigger melatonin production in the brain and which results in feeling of sleepiness. The suprachiasmatic nucleus plays a key part in ensuring that our bodies are in step with our environment and accounts for why we are active and perform best during the day and need to sleep at night. These daily cycles are also known as circadian rhythms and apart from light are also affected by other cues, such as meal times as well as working hours. The circadian rhythms regulate our periods of wakefulness and sleepiness throughout the day. They also rise and fall at different times of the day, with the strongest sleep drive occurring between midnight and 2 a.m, with a much smaller rise between 1 p.m. and 3 p.m. Your circadian rhythm can be gradually adjusted. However, when it's subjected to sudden changes, which occurs because of shift work, as well as travelling across different time zones, the effect is disturbed sleep, reduced alertness, and fatigue. In addition to our circadian rhythm, our actual sleep stages are also important. Our sleep occurs in different stages. Light sleep accounts for about 55% of total sleep time, while deep sleep contributes about 20% of total sleep time and dreaming sleep about 20 to 25% of your total sleep time. When we are asleep, we cycle between these phases, moving from light sleep to deep sleep, back to light sleep, and then into dreaming sleep, before finishing in light sleep. This cycle takes about 90 minutes, although it can be up to 110 minutes, and occurs 4 or 5 times during the night. All phases of sleep are important. Light and deep sleep play a role in our memory, while dreaming sleep helps with processing of emotions and deleting unwanted information. For restorative sleep, a full sleep cycle should be completed. If you are woken from deep sleep, which can happen if you nap for between approximately 20 and 90 minutes, this can leave you feeling groggy, known as sleep inertia, and your work performance after waking could be affected. In addition to these disruptions of our circadian rhythms as well as sleep cycles, long periods of wakefulness, poor quality sleep, inadequate sleep, as well as being awake when you are normally asleep or trying to sleep during the day, all contribute to the risks of fatigue. The relationship between sleep and fatigue is straightforward. The less sleep you have and the longer you are awake, the more fatigued you become. The amount of sleep needed for an individual to perform at their best does vary. However, in general, is usually 7 to 8 hours per 24-hour period. Though individuals can perform on less, it will impact on performance and eventually results in sleep debt. The only way to overcome this is by obtaining more good quality sleep. So, as a manager, how can you improve sleep for your workers? Ways of doing this include ensuring that breaks between work periods are long enough to enable them to obtain enough sleep, particularly between night shifts, as daytime sleep is usually shorter, of poorer quality, and more difficult to achieve. Consider having longer shift breaks, as these give the opportunity to recover from cumulative sleep loss between working weeks. Providing adequate sleep breaks if your workers perform shift work or have been undertaking extensive overseas travel is really important to allow them to recover through restorative sleep. Promoting good sleep practices means providing education not only about the importance of sleep, but giving information on how to get both good sleep between different shift types, as well as how to support alertness during shifts, especially night shifts. Enforce as far as possible no contact out of hours, and match where possible work schedules with individual physiology. Morning types will cope better with early starts, while late types perform better on shifts that start in the afternoon or evening. Encourage your team to seek light during their waking hours, particularly for those working in offices with minimal windows or working at night. In company-managed sleep environments, develop a company standard for the sleep rooms, for example, the provision of blackout blinds, particularly where workers work regular night shifts, making rooms as quiet as possible and providing comfortable beds and bedding. Most importantly of all, encourage your team to make you aware if they feel that they are experiencing sleep problems or difficulties, so that the risks of fatigue can be fully assessed and managed to not only protect the individual, but also the rest of your team from the hazardous effects that fatigue can cause. I've mentioned this already, but as managers and supervisors, we can't manage the aspects of a worker's personal life that could be contributing to their fatigue. But by influencing and creating a culture where they feel able to discuss them, we can take their challenges into account and direct them to resources which can assist in the community or through worker assistance programs. I just mentioned education on sleep for your workers, so what advice can you provide? At Wood, we've provided advice on sleep hygiene. That is the habits and practices that can lead to a good night's sleep. Having a bedtime routine is key. It's how we manage babies, after all. It is something that we can apply to ourselves and be just as effective. Encourage your workers to get lots of light exposure during the day to help improve daytime alertness and regulate the production of melatonin, the sleep hormone. This makes it easier to fall asleep at night. Advise them as far as possible to keep a consistent bedtime. Try setting an alarm for 30 minutes before bedtime to remind you to wind down and start preparing for bed. Routine also involves setting your bedtime to make sure that you can obtain your sleep need. If you know you need 7 hours of sleep a night, aim for at least 7 hours and 30 minutes in bed to minimise the chances of sleep loss. We find it more difficult to sleep in a single block as we get older, but having a set routine may help reduce this difficulty. Switching the TV off at least half an hour before going to bed allows the body to start to relax. Having a warm bath or shower can also help you unwind and can be an important part of your routine. Also, setting an alarm helps to avoid any slept-in panic. Surprisingly, having a regular wake-up time is more important than a regular bedtime. And finally, advise to avoid clock watching. Turn the clock face away from you. What you eat can also influence your sleep, and this should also be included in the training provided. Key advice is to avoid alcohol, caffeine, and nicotine. Heavy meals should be avoided at least 2 hours before going to bed, and alcohol for at least 3 hours. Alcohol before bedtime affects the natural sleep cycle, resulting in disturbed sleep, more awakenings, and leaving you unrefreshed, so it should be avoided. Caffeine should be avoided within 4 hours of bedtime, ideally longer, as it remains in the body for 4 to 6 hours and can reduce sleep quality significantly. Nicotine too should not be used before bed too. It is a stimulant and will disturb sleep. And finally, avoid exercise before you go to sleep, as this can raise the body temperature and make sleep more difficult. The fourth of the background concepts that you need to be aware of are sleep problems. Sleep problems are common. The 2016 Sleep Health Survey of Australia showed that the inadequate sleep of either quality or duration affected 33 to 45% of adults. Sleep problems are common. Sleep apnea affects 9% of Australians, significant insomnia 20%, and restless legs 8% of adults. This information is important, as it will be discussed later. 3/4, 76% who slept less than 5.5 hours reported frequent daytime impairment or sleep-related symptoms. Frequent loud snoring is reported by 24% of men and 17% of women. In these individuals, 70% reported daytime impairment or other sleep-related symptoms. I've mentioned the effect of our 24/7 operations, but this study showed that the effect of the 24/7 society is profound. A quarter of all adults, 26%, use the internet most or every night of the week just before bed and reported frequent sleep difficulties or daytime impairments. Similarly, 16% of all working adults did work just before bed and had frequent sleep difficulties or daytime sleep-related symptoms. Nearly a quarter, 23%, report their typical weekday routine of work or home duties does not allow them to get enough sleep. Sleep problems have a major effect on work performance. In the past month, 17% reported having missed work in this study because they were sleepy, and a further 17% also reported having fallen asleep on the job. In the past 3 months, 29% of adults reported making errors at work due to sleepiness or sleep problems. In addition, the Cooperative Research Centre for Alertness, Safety and Productivity, you may know it as Alertness CRC, have stated that there is up to a 50% increased risk of occupational injury, absenteeism and error or safety violation attributed to fatigue in workers with a sleep disorder. With up to 45% of individuals on safety-sensitive occupations, such as law enforcement and commercial transportation in this category, sobering figures indeed. So, what are these sleep disorders? Sleep problems are thought to be increasing in the community. The prevalence of sleep difficulties and daytime consequences appears to have increased since 2010, with various sleep problems reported by more adults than ever before. Insomnia, which affects an estimated 20% of the community, essentially means poor sleep, but can have a variety of different presentations, including not being able to get off to sleep, or waking too early, waking for long periods in the night, or not feeling refreshed after a night's sleep. Insomnia can also be short-term, in response to a stressful event, and be present for under 4 weeks, or long-term when it lasts over 4 weeks. What you should note is that approximately 50% of diagnosed insomnia is related to an underlying mental health disorder, which also requires to be managed and supported. Sleep apnea is a medical condition where there is intermittent and repeated upper airway collapse during sleep. This means that there are frequent interruptions to sleep, making it less restful, and the individuals experience excessive daytime sleepiness as well as early morning headaches. Research has shown that the odds of a workplace accident is nearly double in workers with sleep apnea. It is a significant fatigue risk factor for workplace accidents and incidents. So, who might you find in the workplace who is at risk of this condition? In the workplace, obese workers, especially those with increased weight around the abdomen and neck, older workers, particularly over 65 years, as well as those who smoke and have a high alcohol intake are all at increased risk. Though a point to note is that sleep apnea can also occur in people who are not overweight or obese. The Adelaide Institute for Sleep Health recently reported that up to 38% of Australian truck drivers have obstructive sleep apnea, so is a significant but largely unrecognised health risk that as businesses we must take this into account. Restless leg syndrome, RLS, otherwise known as Willis-Ekbom disease, causes unpleasant or uncomfortable sensation in the legs and an irresistible urge to move them. Symptoms commonly occur in the late afternoon or evening hours and are often most severe at night when resting, such as sitting or lying in bed. Movements may also occur during sleep and can partially wake the individual and disrupt their sleep pattern. There is one condition I should mention that, although rare, has significant safety implications, and that is narcolepsy. Narcolepsy is a condition where you suddenly fall asleep. These attacks can occur several times a day, and again have significant safety implications, as there is usually no warning this is going to occur. If you or any members of your team experience any of these symptoms, then an assessment with their health professional is crucial, particularly if you are required to undertake safety-critical activities. The last of the background concepts that you need to know are in regard to sleeping tablets. Since we are talking about sleep, it's a good time to mention sleeping tablets. Taking sleeping tablets to help sleep is not recommended, unless they have been prescribed and are monitored by a doctor. Sleeping tablets containing benzodiazepines can be helpful for treating insomnia in the short term, but tend to worsen sleep in the long term. They also disrupt the makeup of your sleep. You have less deep sleep, and it takes longer to reach dreaming sleep. Stopping taking these drugs is also difficult. You can experience rebound insomnia, anxiety, and agitation. If you currently take sleeping tablets, speak to your health professional about whether you need them. Work with your doctor to see if there's anything you can do to reduce the dose, or if you can stop taking them in a safe manner. If you are taking or are considering taking any sleeping tablets, then reading and understanding your company's substance misuse policy is advised. As you might have noticed, all this background information has looked at ways of improving sleep. The reason for this, it's probably one of the easiest ways of starting to tackle the problem of fatigue. The low-hanging fruit where you can make most impacts quickly. However, the best way of controlling the risks is to eliminate the factors causing the fatigue at the source. And if you can't eliminate, then the risks must be minimized. So, how do you go about doing this? Historically, the most common way of managing fatigue has been through compliance with prescriptive limits on working hours. This emphasis, I would suggest, has been more about worker welfare rather than controlling the specific risks from fatigue, and in fact only provides a single and imperfect layer of defense against fatigue-related incidents, if you think of the Swiss cheese analogy for risk. Compliance with the rules does not necessarily mean that it's safe. If you remember back, there was a parliamentary inquiry in 2000 called the Midnight Oil Inquiry that recognised this and recommended that we should approach shift work from a risk-based approach. What this means is that instead of just thinking about compliance with rules of rostering to keep your workers safe, it's about recognising that your workers will be fatigued at some stage, and you need to identify the right level of control to implement within your workforce to manage your risk. This risk-based approach is what we've taken at Wood and managed our risk through the hierarchy of controls, though admittedly, we sometimes are starting at the administration level. Points to note are that rostering alone is not going to solve your fatigue problems, but by applying what has been learnt over the past few decades by better design of rosters can certainly help. Fast-forward rotating shifts work well, as they minimise or certainly reduce disruption to the internal body clock and increase the chance of getting good sleep opportunities. That opportunity to get good sleep and recover from work or shifts is so important. Also, structure shifts and design workplaces so that the most demanding work is done towards the middle of the shift and not towards the end, and certainly not at night if possible. And don't make last-minute changes to rosters unless it absolutely cannot be avoided. Early start morning shifts should be avoided as they can actually decrease sleep duration. Just because you have an early start, as you probably know in yourself, your behaviour doesn't necessarily change. You may still stay up to your usual times anyways, socialising, watching TV, etc. Or if you do go to bed, you can't get to sleep, as your internal body clock is not set for an early start to sleep time. Because of this, those early starts actually increase your sleepiness and should be avoided if possible. Several consecutive shifts in a row is also known to decrease alertness and increase sleepiness, and extending 12-hour shifts just increase that chance of injury, so should be avoided as well. So getting that balance can be difficult between what workers would like, compressing their work week, and being able to spend more time with their family, against the increased risk of injury. And not forgetting to consider the individual factors. Do they have any particular conditions that need to be considered that I've mentioned already? Are they the proverbial owl or lark who does better at a particular time of day? Engaging with your personnel when it comes to work scheduling is invaluable. When it comes to work scheduling, research by Stanford University has also raised an important point to remember, that productivity does not equal time spent on the tools or behind a desk. 50 hours appears to be the maximum hours a week someone can work effectively, so it's something that you need to consider. Other things that you can do to help your work scheduling is to develop procedures to manage and limit excessive working. And remember about culture. It was mentioned earlier. Get engagement with your senior management and get them to practice what they preach. Make sure regular breaks are taken throughout the working day, and schedule safety-critical work out with the 2 to 4 a.m. and 2 to 4 p.m. windows where our natural internal body clocks are at their lowest. Avoid using incentives to encourage your workers to work excessive hours. They are more likely to make mistakes than get that job finished that you wanted done. And make sure that your workers also take the leave that they are entitled to. Have a system so that you can monitor that this is actually happening and that they are not accruing too much leave. Have processes so that you can deal with unplanned leave or emergency situations, such as on-call teams or banks of workers you can access can also help lessen the risks from fatigue. At Wood, our first requirement when arranging meetings is to consider, would we do this without having to be face-to-face? Teleconferencing again can help reduce your fatigue risks and reduce that need for your workers to travel long distances to meetings. Further guidance on work scheduling can be obtained from the Safe Work Australia guidance mentioned before. Other ways to reduce your risks from workplace fatigue is to give your workers training and information around the factors that contribute to fatigue. Half the risk in the Australian workplace comes from factors that are under the control of your workers outside of the workplace, so a lot can be gained by influencing this. Getting an understanding of the number of hours of sleep needed to be able to work safely is a key message. It's a bit like the message that we already have about drink driving, and you can only drive safely if you have below a certain level. So when it comes to sleep, you can only work safely if you have above a certain number of hours sleep. And when you are thinking training, think innovation. Use modern technology. Most people now have mobile phones, so develop apps, be creative, and come up with an app that provides training and educational materials on it, so that those who do the night shift don't miss out. As an extension from this as businesses, we then need to give a clear message that workers need to tell if they have less sleep than they require. In fact, the ethos of this tell is a requirement under the legislation to not only look after yourself, but your colleagues as well. Over the past few years, the redesign and reproceduralisation of the workplace has been closely looked at as ways of how businesses can reduce risks, even when people are tired, and is something that you should also consider when looking at ways of tackling your fatigue risks. Once you put controls in place, it's up to you to monitor them to ensure they are effective and remain so. You may want to consider using trial periods for any changes in rosters and schedules, and allow your workers to offer feedback throughout this process. They'll be pretty quick in telling you if they don't work. From what has been discussed already, you can understand now why fatigue-related incidents are much more complex and need more controls than just rostering. There is no easy answer when it comes to addressing fatigue. If you examine a fatigue-related event, there usually has been a preceding fatigue-related error, which in turn has been preceded by symptoms of fatigue and an individual work-sleep history that has led to fatigue. Think back to all the individual factors mentioned earlier. At each of these levels, there is an opportunity for you to both detect and implement an additional layer of defense against fatigue, which simply following compliance with working hours does not allow. Having a perfect set of rules to ensure safety will not work. There is not only too much variability between workers, workplaces, as well as tasks for something like this to be the answer. I've mentioned it before, but mere compliance does not mean safety, and don't assume that controls will work just because you have put them in place. You need to be continually checking that the controls that you have put in place work. Using a multiple layer of controls approach provides you a more comprehensive as well as flexible style of fatigue risk management. Managing fatigue should be a process like the management of any other workplace hazard and a shared responsibility between yourself and your workers, particularly when it comes to the individual risk factors. One of the best ways of bringing together the system of controls and strategies necessary to manage fatigue successfully are through a fatigue risk management plan. There are several key principles which underpin all successful fatigue risk management plans and which you should use for your plan to be effective. It should be customised to the operation for which it is developed, be based upon assessed risk and evidence, built upon the principle of shared responsibility as mentioned before, and should be integrated into your existing management system. It should also be evidence-based, use data-informed strategies, be reviewed regularly, and quality controlled. Implementing a fatigue risk management plan gives you several advantages, not least that it is a systematic and documented approach to fatigue management. Having a bespoke plan allows you to consider the many different causes of fatigue unique to your operations. The management of fatigue is then risk-based, as opposed to simply compliance and following the rules. Having a plan allows for both reactive and proactive measures. It also provides numerous benefits for your team, including improved health, well-being, and job satisfaction. I've mentioned it before, but having a plan can help reduce absenteeism, increase staff retention, improve morale, and reduce operating costs, and helps to manage your workers' performance by reducing the adverse impact of fatigue and improving productivity and reliability. An effective fatigue risk management plan should therefore not only meet your business needs, but be practical, functional, and determine the controls necessary to manage your risks of fatigue, both existing and potential, that are realistic, implementable, adequate, and most importantly, effective. The purpose of the plan is to put in place layers of defense to reduce the probability of a fatigue-related event occurring in your workplace. Key to your risk management plan is to have a fatigue management policy. Your documented policy should make your business's commitment to the systematic management of your fatigue risks and should also confirm that you will consult on fatigue issues with all the stakeholders. For example, leadership, management or supervisors, workers, clients, subcontractors. It should also confirm roles and responsibilities for developing and implementing the plan, who does what and when, including the responsibilities of workers for ensuring that their actions and behaviours do not create or aggravate risks. Also include in the scope of your plan, who does it apply to? All workers? Or just safety-critical workers only? Contractors and visitors, etc. as well? It should also include a statement of what the organisation deems to be acceptable working hours and overtime limits. You may therefore also need to consider an extended hours approval procedure, particularly if you're involved in emergency work, call-outs, etc. The next step in the plan is the fatigue risk management process. This involves a lot of the activities already mentioned: collecting your information on fatigue as a hazard, analysing the risk, setting up and documenting the necessary controls, including training, awareness, and communications, as well as checking the extent that the control measures have been successful. I've spoken already a lot about what you need to consider, but as a reminder, the key headlines are work planning and scheduling, commuting times, environmental conditions, organisational factors, unplanned work, the mental and physical demands of the job, as well as need for adequate breaks and restorative sleep. I've also already spoken a lot about influencing the individual or personal factors, but there are also certain groups within the workforce who are more vulnerable to the risks of fatigue, for whom you may need to consider additional measures. These are your young workers, older workers, new and expectant mothers, workers with pre-existing medical conditions such as sleep apnea, heart disease, workers taking time-dependent medication such as insulin-dependent diabetes, and temporary or seasonal workers. Other things you need to consider as part of the risk management process includes developing leading and lagging fatigue key performance indicators, including details of how these are reviewed, how often, and by whom, what exemptions you may need to consider and document for your specific operating conditions, how these will be applied, and under what conditions. Also, what sign-off is appropriate. And finally, and importantly, you must document the fatigue controls you are putting in place. Biomathematical models can be useful when you're assessing group work schedules and can help predict fatigue levels. The rail industry in Australia commonly uses the Fatigue Assessment Tool by Interdynamics, FAID, but there are others, such as the Fatigue and Risk Index, as well as SAFE available. These models are designed to consider a range of factors relating to fatigue and to convert them into simple numerical scores representing fatigue risk. These numbers can then be used to either compare different schedules or evaluate a particular schedule against an upper fatigue limit. However, there are limitations to these, so much that the Independent Transport Safety Regulator in 2010 put out an alert to remind organisations that these models are based on group average information. They advised that they should not be used as the sole basis for decisions on fatigue impacts for the individual workers. There are also subjective assessment scoring tools, such as the Sam Pirelli Index and Karolinska Sleepiness Score, which can also assist in evaluating the risks of fatigue. But remember, There are no absolutes in measuring fatigue. All of these scoring models only give indicators of a risk, but they can be useful in giving an indication if fatigue could be a problem. 5 levels of defense are recognized when it comes to reducing the likelihood of fatigue-related error or incident. The most effective fatigue controls sit at the organizational business level and addresses the primary cause of fatigue, lack of sleep. These Level 1 interventions, which you have control over, are aimed at both improving sleep opportunities as well as the amount of sleep. As a business, you must ensure that how you organize work is providing enough sleep opportunities for your workers. I've already spoken a lot about how you can manage your rosters, but there are some points that you should also remember. Controls for fatigue can vary in their effectiveness. Eliminating safety-critical tasks from the night shift is more successful than ensuring a well-lit environment. Level 2 controls are focused on the individual and encouraging them, when given the opportunity to sleep, to obtain enough sleep. This entails providing education on how to obtain good sleep, encouraging your team to calculate their individual fatigue risk scores, providing guidance on how to spot team members who fail to get enough sleep, as well as providing a clear reporting system for when any team member is fatigued. More will be discussed on this later. The Level 2 controls are closely linked with the Level 3 behavioural monitoring and self-reporting. Detecting symptoms of fatigue forms the Level 3 layer. So what should you be looking out for? Even though the 2 previous layers may be perfect, there is the possibility that cumulative fatigue could impair performance and introduce risk onto your workplace. This level helps both you and the worker identify fatigue through simple measures, such as the subjective questionnaires, as well as looking for signs of fatigue. Any worker who presents with the signs documented in the slide in a short period of time is likely to be experiencing fatigue-related impairment, and which you need to act upon. So train your managers and supervisors to recognize these signs. A way of managing this is if you have identified any fatigued workers in your workplace. Discuss the issue of fatigue with them as soon as practicable. You may also choose to discuss the issue with other workers who could also be at risk of fatigue. Following discussion with a fatigued worker, you have several options to manage them. You could tell your worker to take paid personal or annual leave if they have any paid leave entitlements. Otherwise, you could allow the worker to take unpaid leave if they wish to do so, or choose to grant the worker paid leave if they have exhausted all of their other leave entitlements. I'd also recommend that you include a clause in your workers' employment contracts that states that you reserve the right to send a worker home from work if you believe the worker is not fit to perform their duties. However, as a point of note, I've already mentioned that driving while fatigued can be dangerous, so don't let your workers just jump into their cars. If you decide to send a fatigued worker home, arrange a safe method of travel for them. For example, a taxi or colleague, and check that they have arrived home safely. Part of the 3rd layer of defences is self-reporting, and I'll speak more about this later. Going back to our layers of defence, we are now at the Level 4 defences. These involve fatigue proofing. This includes the controls for the mental and physical demands for the work your team undertakes, managing the environmental workplace conditions, as well as using napping, additional monitoring, and additional breaks to reduce the risks. In essence, fatigue proofing is about managing your fatigue risk on a day-to-day basis. Control measures that you can put in place to reduce the mental and physical demands which have been successfully used at Wood are job rotations to limit the build-up of fatigue, better work planning to account for peaks and troughs of activities throughout the life cycle of projects. Other activities that you can do are contingency planning. This is certainly something that we've had to consider when workers have become fog-bound for days on offshore platforms. But also using fit-for-purpose plant and equipment too can also make a difference. When it comes to managing your environmental conditions, avoid working as far as possible in the heat of the day. If this is not possible, then minimise your workers' exposure by using job rotation, and make sure that you also provide a cool shaded area where workers can rest, recover, and have access to plenty of water to rehydrate. Having a well-lit, safe and secure workplace also helps, and if your workers live on site, that they have access to suitable rest, sleep and meal areas. Using low vibration seating as well as low vibration hand tools can also assist when it comes to reducing your risks of fatigue. Fatigue proofing can contribute to reducing safety risks associated with fatigue, but the only way to effectively control the risks over the long term is to ensure that your team obtain adequate sleep on a regular basis. Your final level of defense is Level 5, which involves incident analysis and monitoring. Again, another key component of your fatigue risk management plan. But before I speak about this, I do need to speak about how your team can self-report as well as report fatigue in others. This means you should document and communicate how to report, who you want your workers to inform, as well as where and how this information is recorded, and include this in your plan. Using validated subjective self-screening tools can be a helpful way of assessing your team for the risks of fatigue. Your team should be aware that if they are not fit for work due to fatigue, they need to notify you. The same applies if they feel they are becoming fatigued at work. Honest and early communication allows the necessary controls to be implemented promptly and reduce the harmful effects that fatigue can cause. Having a supportive workplace culture and an effective fatigue reporting system is critical to your successful management of fatigue. It allows not only current fatigue risks to be identified, but also enables systematic fatigue risks to be identified too. Reporting should be encouraged and not criticised. Something else that you need to document in your plan are your training requirements. This should include the minimum requirements, as well as time for refreshers. Training should be tailored to reflect the unique fatigue risks your team face and how it not only affects them, but their families and colleagues as well. Providing information and training about the factors that contribute to fatigue and the risks associated with it will not only help them in their job, but also help them implement measures to minimize the risk from factors outside of the workplace. Fatigue-related incidents usually occur as a result of a combination of factors, rather than due to simply fatigue alone. Fatigue often exacerbates what is otherwise a manageable situation as a result of errors in judgment which may not otherwise have occurred. Your plan should include what to ask when considering fatigue as a contributory factor in any accident or incident, when this should be asked, as well as how to record such fatigue-related events and investigations. As a result of your investigation, you should be able to answer the following questions. At the time of the incident, had your team member been given enough time off to get adequate sleep? Had your team member actually obtained enough sleep in the rest period? Was your team member exhibiting any of the symptoms of fatigue leading up to the incident? Are the errors that caused the incident indicative of fatigue? To help answer this question, guidance is available in the form of a checklist. However, they should be relevant for the particular circumstances that you are working under. And what are the possible reasons for your team members' fatigue? It is also important that you rule out other possible causes of impairment, including underlying medical conditions, prescription, over-the-counter, as well as illicit drugs and alcohol, all of which could have contributed to the event. Once the cause has been identified, you can put the appropriate countermeasures in place. Now that you've included incident investigation in your fatigue risk management plan, the other components that you need to include are sleep disorder management and audit and continuous improvement of your plan. Sleep disorder management entails providing specific guidance on how those workers with underlying conditions are managed and supported in the workplace. This involves 3 components: designing health assessments, screening and disease management programs that consider the impacts these health conditions have on shift working. Secondly, ensuring that your team who undertake shift work have the same opportunities to participate in health promotion activities as well as training and health assessments as the rest of your team. And thirdly, providing guidance to your team on how to advise any changes to their health status, whom this should be reported to, how this information is managed and recorded, and how the process of further assessment is then undertaken. Now on to audit and continuous improvement. This requires a continuous improvement cycle to be set up that delivers corrective actions via either internal or external auditing as required. Your fatigue risk management plan should be audited at least annually or in accordance with the auditing cycle for other safety management systems. The purpose is not only to identify areas of improvement, but also changes necessary to reflect organisational developments as well as the latest best practice guidance. Your audit should assess 3 key areas: whether your fatigue risk management plan is functioning as intended and in accordance with its policy and associated procedures. Secondly, whether the key performance indicator targets are being met. And thirdly, the extent to which your plan is in fact effectively managing your fatigue risks and reducing the hazard within your operations. As with any audit, any gaps or deficiencies must be recorded, allocated a responsible person, a rectification plan developed, and an agreed deadline put in place for this to be enacted. These corrective actions form part of your continuous improvement process. Finally, the last 2 parts that any fatigue risk management plan should include are the document review cycle, its sign-off, as well as the version control and approval table. Now that you've developed your plan, the next hurdle to manage fatigue in your operations is to get it implemented. Developing a fatigue risk management plan requires hard work, dedication, and commitment. But when designed to meet your particular operational fatigue risks, brings significant benefits to both your team as well as the organisation. Be prepared for it to take 1 or 2 years for a site to develop a fully functional plan. Developing a plan involves multiple stages. Remember, the plan must represent the risks that are unique to the particular site or operation the plan is for. It's not a one-size-fits-all. The processes described before should have given you an understanding of what is required in developing a plan, so the next thing to do is actually get it done. Developing a roadmap of all the stages that you need can help keep you on track with what you need to do. First of all, identify all the relevant legislative and regulatory requirements and guidelines that apply to your particular industry. Consider that you may well have client-specific site requirements as well, which may limit the maximum hours worked as well as minimum hours that are available for rest. Next, complete a gap analysis against this with what you are currently doing and management processes that you have in place at present. From this, highlight the key fatigue issues you face in your business and why a fatigue risk management plan should be implemented. As you know, with any health and safety initiative, for it to land and become ingrained in your business, you must have senior management buy-in. Your roadmap should also identify who will champion your plan at leadership level. But don't only get commitment from your senior management. You also need agreement from your supervisors and workers to support this process. Everyone needs to support the plan for it to be effective, so consult, and consult. To get that buy-in, you must be able to articulate the background as to why your business needs to address fatigue. What, if any, of your current practices are? The culture of your business in relation to fatigue risks? What, based on your initial survey, your fatigue risks are? Who is affected? What effect these fatigue hazards cause? And finally, how having a plan will eliminate or certainly minimise these. Most importantly, once you have that buy-in, and for your own sanity, get a work group together to develop your plan. You can't do it all by yourself. Identify the resources required to set up your plan, the numbers involved, skills required, as well as the commitment from senior management that you will be given enough time to undertake the necessary activities. Consultation is a crucial part of the next stage to help you both develop the policy and to undertake the necessary in-depth fatigue risk assessment. As part of the initial as well as ongoing development of your FRMP. I can't emphasize this enough. Your teams are the ones often best able to identify the fatigue risks and suggest practical controls, so use their knowledge. In addition, your risk management processes may well also include undertaking data or intelligence gathering, fatigue surveys, using biomathematical models to assess fatigue risks in working time arrangements, as well as understanding the current safety culture, including where there may be any known obstacles. We spoke about the challenges earlier. Make sure you know what they are and plan how you can reduce them. The result of all your data or intelligence gathering is that you will now have a clear understanding of concerns or issues that must be addressed. What it also means is that you will likely have identified a lot of issues. Examples of things identified at Wood that may assist you included that we needed to address travel in work time and under what conditions this would be included in calculating work hours. Other issues we've identified that we still need to think about include how commuting long distances are to be handled and how actual hours of work are to be tracked in comparison to planned hours. I certainly don't think we've cracked this one, as even within our oil and gas operations we have multiple different ways of doing this, including gate passes, timesheets and pay slips. Other things that we've had to think about, and which may be of help to you, include determining the maximum number of allowable consecutive shifts. I should point out this is often influenced by bargaining agreements, or the sheer fact you can't get someone off an oil rig after a week. Also, the minimum hours we set between finishing off one shift and the beginning of the next. Napping is something else we've had to think about. Is napping in work time allowable? And if so, how is it to be managed? Accommodation as well is something that we've discussed with clients, and how the layouts in camps or rigs related to day and night shifts can be better managed. We've also developed journey management plans for long-distance driving, and just now are looking at how we can address international and business travel, considering the impact of time zones as well as direction of travel. And finally, a big thing for us at Wood is how we better manage the effects of shutdown, turnarounds, emergency, as well as crisis management. So, once you have done all this and developed your plan and documented it, including your measurable objectives, you need to develop your rollout plan. A word of advice: keep your fatigue risk management plan short, concise, and punchy. You want people to read it, but provide more detailed guidance to support it. And last of all, plan how you are going to roll out your plan. To roll out your plan, there are lots of things to do and develop, including your training materials, assessment forms including fatigue questionnaires, reporting templates, fatigue investigation processes, posters, etc. At Wood, we've developed a library of guidance material about a whole host of mitigation strategies that aren't going to be applicable in all circumstances, but the guidance is there for the different projects to pick and choose what is suitable for them and the circumstances they work under. There's guidance on sleep hygiene, how to maximise rest if shift working. This also provides information workers can pass on to their families on this subject. General information on broader health and well-being topics, such as diet and exercise, as well as to help the overall well-being of our workers. Consider having a trial period if your operations are big enough to identify any teething issues. And inform your clients what you plan to do and enlist their cooperation as well. And talking from experience, you may find that you doing something is the impetus that they need themselves. You also need to pick a date for the rollout of your plan, ensuring that there are clear communications that this is going to happen to ensure the necessary engagement and supportive environment for this to be effectively implemented. Go back to your leaders and get them to support rolling out the plan so that the same message goes out to everyone on the same day. And make sure that you've created training materials for both leadership, supervisors, as well as your workers. As part of developing your plan, make sure that you have also flagged the need for and identified adequate supervision for your plan to really work. They are so important in this, and also make sure that you emphasise where further assistance can be obtained by your workers if they need more help or information about fatigue. From experience, you can never remind your workforce too much about your worker assistance program. Once your plan is up and running, you then need to monitor for the effectiveness of your plan and adjust as necessary. Your challenge as manager of the fatigue risk management plan is keeping the momentum going. Fatigue risks don't go away, but they can be managed successfully.